So what needs to happen? Well, what do we have here? We have an ovum. And what do we have here? We have a sperm. And then we have fertilization. We have creation of a zygote. And now eventually develops into embryo, fetus, and now we have it developing. So we have pregnancy. What does that do? How is this related to breast development? Well, we have to talk about those two hormones again. So the hormone concentration, here is like no units right here, but I'm just showing you the overall trend. So remember, estrogen, progesterone during the menstrual cycle. Remember, estrogen rising, falling, progesterone rising and falling, but progesterone rises again after ovulation. Now, the thing is that what happens here? Now we have an increase in estrogen. So a woman is pregnant. Now levels of estrogen and progesterone go through the roof. This is levels you wouldn't normally see during a normal menstrual cycle without pregnancy. And that makes sense. Why? So the thing is that, well, one, what is that going to do to the mammary gland? More estrogens, more branches of the ducts and longer ducts, and now more progesterone, you're going to get more lobules. More lobules means more alveoli. More alveoli means production of more milk. So all these lobules, all these ducts take up volume. So this is why the mammary gland and breasts get bigger during pregnancy. But remember, what else does progesterone do? What does it do to the endometrium? Remember, progesterone is there to maintain the endometrial lining, right? So it makes sense because, again, you don't want that progesterone level dropping and then all of a sudden you have sloughing off of the functional layer of the endometrium, and then you're just like throwing out the baby with the bathwater. So if you want to keep that pregnancy, you want to keep progesterone levels high so that you're maintaining that layer. But not only does it maintain the endometrium, it also causes this proliferation of lobules in the mammary gland. So the thing is that it's maintained, but once a woman gives birth, it goes back down to normal. So this is why breasts are only fully developed when a woman is pregnant. Because why? That's the only time that a woman will experience this very high levels of both progesterone and estrogen. But once it drops back down, these excess lobules and ducts start to undergo a process we call involution. So this is why it shrinks down. If you start losing the lobules, start losing the ducts, then the overall mammary gland gets smaller and the breast tissue gets smaller. Again, that's what happens. Okay, so a single duct can have multiple lobules. So this is why you have, and each lobule has what they call a single lactiferous duct. This is the final stop just before the nipple. So this is where you store milk before ejecting it. So lactiferous duct, again, it's a large shaver or lactiferous sinus. So or actually, let me rewind that a bit. So the sinus is actually where you store it, but the duct, this is the final duct that actually carries milk from all those ducts and lobules, and finally out into the external environment, so you can nurse that baby. So about 15 to 20 sinuses per nipple. So again, these ducts and sinuses, they're in men too. It's just that the ducts and lobules that are developed during pregnancy in females, that doesn't happen to men. All right, so what we have here are these lobules. And again, many lobules to an individual duct, all these ducts leading to a single lactiferous duct. And this is what we call the lactiferous sinus. About 15 or 20 of them. I'm only showing 3 here for simplicity, but these are all the lobules, these are all the ducts, and these are the sinuses and lactiferous ducts. So again, lactation, what happens? Well, there's another protein, and hey, this might sound familiar, back to chapter 18, endocrinology, prolactin, right? So prolactin, so this is being secreted. So what happens is that during pregnancy, prolactin goes through the roof as well. And this stimulates the production of milk. So it's, again, promoting lactation. So this stimulates all the lobular cells and then alveolar cells to make milk. And during what happens during after pregnancy and then you have birth, well, the thing is that prolactin still maintains high. So the other cool thing is that as long as you're breastfeeding, prolactin will stay high compared to estrogens and progesterone, which drop as soon as you or after you give birth. So what we're having is lactation, accumulating lactiferous sinuses, and then you have the milk ejection reflex when the baby suckles on the nipple. Now, let's talk about breast morphology. Okay, we're done talking about the mammary gland itself. Now let's talk about the overall structure of the breast and tissue itself. Now what we see here are, again, we see the lobules all leading to a duct, and then the lactiferous sinus and leading to the nipple. But what do we have here? What's this yellow part? This is pectoral fat pads, so it's subcutaneous fat. So as you can see, it does make up a lot of the volume of a breast. And then what we have here, these little parts right here, this is connective tissue, and actually they're kind of like tendons, right? But they're not quite tendons. These are ligaments. So these are also known as Cooper's ligaments, or your book calls it suspensory ligaments. So these help to suspend. So this actually is a major factor in determining the overall shape of a breast tissue. So again, this is why some breasts hang off more towards the side or down, or sometimes they're more pointy or more round. It all depends on the overall architecture of these suspensory ligaments. Now, what do we have here? So the thing about is that the pectoral fat pads give volume. So as you can see, this yellow stuff, a lot of this yellow fat. But the thing about these suspensory ligaments, this is what actually gives the shape. So again, they're not going to determine the volume. But the thing is that fat by itself doesn't really have a really solid shape. It's these ligaments that hold this fat and the mammary glands and lobules in place that determines the overall shape of a breast. So this is also why if a woman loses weight or gains weight, why that might also affect the shape of her breast. Why? Well, if she's losing all this adipose tissue or gaining adipose tissue, this can also change the volume of her breast as well. Again, it's those ligaments that actually determine the overall shape. Now, the thing is that ligaments, they're connective tissue, but they can also stretch due to age, to weight loss and gain, and pregnancy. So sometimes women who do yo-yo dieting and where they lose or gain weight very rapidly, they might actually have permanent changes in the shape of the breasts and pregnancy and age. So the thing is that a woman's overall shape of her breasts will change as she goes on through life due to all of these factors. So how can you prevent sagging of breasts? Well, look at where these suspensory ligaments are attached to. So one way you can potentially help, well, there's also a surgical way, which is doing like a breast lift. But notice that all of these ligaments attach to pectoralis major. So that's why sometimes, I mean, I haven't seen real clinical evidence about this, but one proposed way of doing a natural breast lift, hey, if you build up your pectoralis major, make this more taut and tight, then this would also bring along the suspensory ligaments for the ride. So that might be something that helps to prevent sagging. But whether push-ups actually help prevent sagging, I think there is a study somewhere, but it wasn't really conclusive, or it was a very small sample size.